We've not discussed them in a couple of weeks, but the government is still holding daily press conferences to discuss the coronavirus outbreak. Since Johnson was taken ill with the virus, the events have been led by a variety of government officials, including Dominic Raab, who's been standing in for Johnson during his recovery. Anyway, in yesterday's press conference, there are a few pieces of big news, not least that the UK was extending its lockdown procedures for at least 3 more weeks. So in this video, we're going to discuss the progress the UK has made in fighting the virus so far, and why the government is extending the lockdown, before also discussing some of the other major stories coming out of yesterday's press conference. Before we dive in, I wanted to highlight that we have a few new items on the TLDR store, including a whole bunch of new button badges, new magnets, and the reintroduction of the mystery pin badge, where we'll send you over a random design for nearly half the standard price. Check out these items and a bunch of other stuff over in the TLDR store. Despite the ongoing lockdown procedures, the UK has seen its total number of coronavirus cases and deaths continue to increase significantly in recent weeks. The current figures from Public Health England put the total number of confirmed cases at 103,093, with 79,489 in England, 7,102 in Scotland, 6,401 in Wales, and 2,201 in Northern Ireland. Unfortunately, this high number of cases also corresponds to a high death toll, with 13,729 deaths seen in the UK so far. This makes the UK the country with the 6th highest rate of infections and the 5th highest total deaths. These numbers are plateauing slightly, with the 5-day moving average starting to fall in recent days. But just because the numbers are starting to improve, doesn't mean that the government can relax restrictions, with the total number of new cases each day still very high. Rob commented on the situation and why restrictions can't be lifted during the press conference.
Step by step, our action plan aims to slow the spread of coronavirus so that fewer people need hospital treatment at any one time, and that's the way we can protect the NHS from becoming overwhelmed. There are indications that the measures that we put in place have been successful in slowing down the spread of this virus. But SAGE also say that it is a mixed and inconsistent picture, and in some settings, infections are still likely to be increasing. But overall, we still don't have the infection rate down as far as we need to. The very clear advice we've received is that any change to our social distancing measures now would risk a significant increase in the spread of the virus. That would threaten a second peak of the virus and substantially increase the number of deaths. So early relaxation would do more damage to the economy over the longer period. The advice from SAGE is that relaxing any of the measures currently in place would risk damage to both public health and our economy.
In his announcement, Dominic Raab stated that there were 5 conditions that needed to be met before the lockdown could end. These are making sure the NHS could cope with the lockdown ending, there being a sustained and consistent fall in the daily death rate, us having reliable data showing the rate of infection was decreasing to manageable levels so that hospitals didn't become overwhelmed, ensuring that the supply of tests and personal protective equipment, or PPE, could meet future demands, and the government being confident that any adjustments made would not risk a second peak in infections or deaths. Currently, according to the government, we just aren't at this stage yet, and the government didn't give an indication of when this point would be reached. What Raab did say is that it still looked like the Prime Minister's warnings at the beginning of the pandemic that it could take up to 3 months for us to reach the peak are still looking accurate, suggesting that the lockdown could continue for some time longer. Ultimately, this is very unsurprising news, and anyone who's been following the outbreak and the news surrounding it will have expected the lockdown to continue. The efforts and sacrifices that are being made right now do seem to be working, but due to the lag in infections and deaths, it's not super easy to track day by day. But the general trends suggest that we are heading in the right direction. The problem that we have is that if we let up now and we return to normal, we're risking that all of the hard work and sacrifice put in so far will have been in vain. Unlocking the economy might be popular with some in the short term, but if it leads to another spike, as is expected, it could lead to huge increases in death tolls and lead to further lockdowns in the future. Some are beginning to ask how long this can be allowed to continue though. The lockdown is certainly taking a toll on the country when it comes to the economy and other factors like mental health. We even made a video about the balance between prioritising lives and the economy, and it's not an easy decision to make. But at this time, the government continued to think that the economic damage that would be caused by letting the virus spread is greater than any damage the lockdown causes. People are itching to see an exit strategy though, with even the leader of the opposition, Sir Keir Starmer, encouraging the government to lay out their plans to bring the lockdown to an end. Government officials worry that disclosing information about the exit plan, or even discussing it, could distract from their core message. And even beyond that, they don't want to make promises that they can't keep. As time goes on, we understand more about the virus's spread, but there's still a lot we don't know at this point. What is clear is that any exit strategy will be slow and cautious, with some elements of the lockdown being loosened while others are being maintained. That's because the key focus will continue to be on the health service. And while restrictions are being loosened, the government will be keen to make sure that the changes aren't overwhelming the NHS's capacity. Another topic discussed at the press conference was the usage of masks, with Professor Chris Whitty, the government's chief medical advisor, discussing the topic.
On the question of masks, if you could illuminate how you reached the government's line that masks are no help outside a care setting.
Well, it's certainly the case that if there was ever a competition between healthcare workers and care workers in the front line, and people are using them in situations where the risk is incredibly low, I don't think it takes a scientist or a doctor to work out that would be a very bad thing to happen. And that's one of the reasons why the World Health Organization reiterated its advice that in most settings, masks should be for healthcare workers. However, this is a very live issue that we are re-examining, but the point about scientific advice is it evolves. And that is one of the things that we have to do the whole time, is re-examine evidence as it comes in.
The problem the UK has is the huge shortage of personal protective equipment, or PPE, in some areas. You've likely seen worrying photos all over the internet of medical professionals donned in makeshift protective gear due to a lack of PPE. Encouraging the general public to use such equipment could just exacerbate the issue. The PPE shortage is a major problem in the UK at the moment and around the world, and it goes a lot deeper than Facebook posts. Medical professionals across the country aren't getting the protection they need, putting their lives in danger and increasing the likelihood of them spreading the virus themselves. This has been a hugely controversial issue, with the government getting a lot of heat for their slow response to the PPE shortage. This pressure hasn't been helped by the UK government's repeated refusal to take part in the EU's joint procurement initiatives, despite multiple invitations, as well as statements from politicians like Hancock when he seemed to blame the NHS's staff for the shortages, saying that they need to treat PPE as the precious resource it is, followed up by Priti Patel's apparent non-apology the following day, saying that the government was sorry if people feel that there's been a failure to supply sufficient PPE. Finally, and because we're TLDR News, it's kind of obligatory for us to bring this up, but the issue of Brexit has resurfaced in recent days. On Wednesday, the International Monetary Fund's managing director was asked what she thought about the possibility of a no-deal Brexit if the UK refuses to extend the negotiations due to the coronavirus. She responded that in a world of unprecedented uncertainty coming from the coronavirus, it would be wise not to add more on top of it, encouraging the UK and EU to extend negotiations until they're able to focus on the issue once again. Despite the IMF's encouragement, the Prime Minister's spokesman told reporters that there'll be no extension to the transition period, simply remarking that we will not ask to extend the transition, and if the EU asks, we will say no. He went on to say that extending the transition would simply prolong negotiations, prolong business uncertainty, and delay the movement of control of our borders. So it looks like with negotiations on hold, no intention to extend the timeline, and attention elsewhere, the UK has little hope of achieving a deal. We're thinking about putting out a full video on the increasing likelihood of no deal in the coming days, so give this video a like and comment down below if you'd like to see us discuss that topic. What do you think of the UK government's response to the crisis so far? Do you think continuing the lockdown is the right decision? And do you think that the government has failed health workers by not providing enough PPE? Let us know your thoughts in the comments below, and as always, you can get involved in the conversation over on Discord. If you want to be updated on the coronavirus crisis as it continues, be sure to subscribe and hit the bell icon to be notified every time we release a video. You can also find more from us across all social networks simply by searching for TLDR News. Special thanks to our Patreon backers for making videos like this one possible.